So, doctor, I would like to ask you few questions. Okay.
Definitely.
So, doctor, how many patients you see in a day?
On an average, I see around 30 to 35 patients every day.
Okay. And what is the most intense moment in your work?
I think the most intimidating, intense moment is when you are treating children. You know, as mothers yourself, it gets very intimidating, and it is a very difficult scenario to see the child as well as the parents, suffer through the treatment. But once they get treated, it is rewarding as well.
Yes, very true. So, doctor, how do you handle high pressure situations?
So oncology throws a lot of challenges day in and day out. But the important thing is we live in an era of multidisciplinary teams. So we always have our colleagues, our team members to support us through all these. And I think technology is something which has become a co-pilot to us. So in these moments, you have to use your clinical acumen, you have to consolidate all the knowledge you have and all the experience you have had in certain scenarios. And I think Lord Almighty does help you through these difficult circumstances at times.
Right. And what do you do to, unwind after work?
That is something we would really need, Oncology is pretty demanding. It is draining emotionally at times. So I have a very, very, lively lifestyle. Once I leave the hospital, when I reach home, I have a small dance studio.
Wow.
And I unwind myself with an hour of dancing 2 to 3 times in a week.
Nice.
And I think playing with your own children is also very, very euphoric. That really takes away the stress out of your life.
Yeah. And doctor, what is the biggest misconception about cancer?
The biggest misconception is that it will not happen to me. People think that cancer happens to only those people where cancer runs in the family. However, it is not true. Cancer can happen to anyone.
Right.
It's just around 5 to 10% of cases which are genetic in nature. So that notion has to be broken.
Right. Very true. Another question I have for you, what are the small lifestyle changes people can make today to reduce cancer risk?
I think the biggest thing they can do is go back to the basics. Whatever our grandparents were doing, they were eating well, they were exercising. That is the mantra for dealing with a lot of diseases, not just cancer, any lifestyle diseases, be it diabetes, hypertension, hypothyroidism. If you're eating good, that is a good amount of fiber in your diet, less fatty food, less carbohydrates, and exercising at least 180 minutes in a week, you're reducing your chances of dying with this disease by 50%.
Agree, doctor, yes. So, another question is, what cancers are most common in India and why?
So in women in our country, breast cancer is the most common cancer, followed by cervical cancer. So breast cancer primarily is because now we're getting more and more westernized. Our lifestyle, as we were discussing, is changing. Another factor which is associated with breast cancer is that there are hormonal changes. So women who are getting married late children, have prolonged cycles because of early menarche, late menopause, they are more predisposed. Cervical cancer happens because of an infection. The human papilloma virus is the virus which is culprit for causing this cancer.
Oh, is it?
But fortunately, we have a very effective vaccine towards it. So if a girl gets vaccinated well in time, then her chances of getting this cancer are minimized by the tune of almost 95%.
Oh.
And in men, mainly it is the lung cancer, head and neck cancer, and colon cancer and pancreas cancer is also increasing. But head and neck cancer because of tobacco consumption and lung cancer because of tobacco consumption is rampant in our country.
So, doctor, how important are screenings?
Screening is the biggest tool we have in our hand. We recently had a campaign in the hospital. Uski tagline ही थी, जांच ही जीत है. So if you are picking up cancers by screening in early stages, and there are stage 0 also for certain cancers.
Okay.
So if we pick them early, the extent of treatment which is required, it is less, expenditure is less, side effects are less, and the chances of cure are very high.
Okay.
So that is why early screening really saves lives.
Okay. Doctor, can you explain what a person should do if they notice a suspicious lump or symptom?
So importantly, one should not ignore. Many a time it happens that if there is a lump, person says, "Dard nahi ho raha hai, it is not painful, so let me just wait and see what happens to it." So one should not do that because cancer does not cause pain in initial stages.
Okay.
So if there is any lump in your body which is recent in onset, or a lump which was there in your body suddenly starts to grow, you should immediately seek medical attention and get it checked to rule out that it is not cancerous.
Okay. And doctor, how has cancer treatment changed in the last 10 years?
Oh, so cancer treatment definitely has changed leaps and bounds in the last 10 years.
Okay.
We are living in an era of minimalism. So
Right.
we are doing a lot of what we can say robotic surgeries, which are minimal invasive. So not only the chances of doing good surgeries have improved, the quality of life patient which has after surgery is better, because now we can discharge the patient on third day. Otherwise, the patient would have spent 10 days in the hospital. So the quality of life has improved because of improved surgical skills, availability of robotic treatments. In chemotherapy sphere also, a lot of things have happened. You must have heard of a lot of cancer vaccines,
Right.
immunotherapies
Yes.
which have come in, which have really improved the chances of survival.
Yeah.
I'll tell you, when I was training lung cancer stage 4 patients, if they had adenocarcinoma, we used to say 9 to 11 months of life. And now patients are coming to us even at 10 years, even 7 to 8 years disease free because of good targeted therapies in certain circumstances where they have certain target mutations.
That's amazing.
And talking of my own field, radiation, I think there has been a facelift in radiation. The techniques which we give now are causing less side effects. So our precision has improved. We are doing very, very focused radiation, leading to improvement in tumor control, and the side effects are minimal now.
So, doctor, what is one technology or breakthrough that excites you the most?
So I think there is something you must have heard of in the media also, and this is something which is very exciting, is the CAR T cell therapy.
Yes, yeah.
So a lot of research is being done, and now it has been clinically also proven that for certain cancers we can enable your own body to fight cancer. So some vectors are put on which the mutational cells are added, which can serve as antigens, which is identified by the body as a foreign body, and the body itself is fighting. So this sort of a treatment is something which will enable your own body to fight cancers, thereby reducing the chances of side effects also.
So, doctor, how is AI improving cancer detection?
So there are a lot of tools which have come in by the deep machine learning, where these machines can analyze the scans and pick up certain changes in the body which are picked up much earlier than a radiologist or a human mind would pick up. So these are still to be validated in many scenarios, but we see a lot of scan reading AI mechanism by which we can pick up cancers early. And a lot of tools are coming which are analyzing the genome, the DNA as well, where by analysis of the DNA genome you can predict that certain risk of this particular cancer exists in this person. So you can screen that person more frequently or more diligently can be followed to pick up cancer in a very early stage.
Is robotic surgery actually better than traditional surgery?
So robotic surgery is definitely very good in many clinical scenarios. It may not hold true for all cancers. When we study cancers, we try to do trials to analyze the efficacy of these new modalities. For many cancers like endometrial cancers, prostate cancers, robotic surgery definitely has made a difference. So the biggest advantage is that the surgeon has a very good access because the instruments are fine.
Yeah.
Ultimately, it is the surgeon who's operating.
Yeah.
It is just the instruments which are robotic. And the patient recovery is very good. The amount of blood loss and patient recovery is tremendously improved. And most of the times, patients go back home by the third day if they have undergone a robotic surgery.
Okay, okay. And what is the future of personalized cancer treatment?
So I think future is looking very bright and sunny, but still a lot of things are in the lab. So the studies in the lab do indicate that now they can pick up cellular DNA also. We call it ctDNA. So many treatment will be dictated by the presence of these cells in the body. So instead of doing big scans, just a blood sample will be taken, and with that blood sample we will be able to find out that the cancer is still persisting or it is going to come back, and we can modify our treatments. So these are the treatments which are likely to add to our armamentarium and make us more and more capable of treating our patients well.
Thank you so much, doctor. It was very informative and insightful. Thank you so much for your time.
Most welcome.